What's up, everyone? Hope everyone is well. Such a pity that we can't talk about boxing when the schedule was promising to be, pretty decent for the year. So let's talk a little bit about COVID-19. By the way, does anybody know what happened to COVID-18 or COVID-6, for example? There's all news of those entries have just totally disappeared. I guess they're probably on some clandestine witness protection program. Anyway, I wanted to dive into the news, but specifically in the United Kingdom, which is always in the news. Brexit or some other commotion which gets pretty much attention in all world media and domestic news channels. So plus I've spent a lot of time over there, so I thought let's have a look at what's happening in the UK, what are news agencies reporting, and then just try and have a look at the statistics published by the Office of National Statistics, because I just want to have a look at the death rates, for example. All right, now a total of 138,913 deaths were registered in England and Wales between 28th of December 2019 and 20 March 2020. So yeah, it's not an entire year, it's just pretty much the end of December to pretty much the end of March. Now, when the Office of National Statistics compile their data, generally the difference between a death occurring and a death being registered is it's about 5 days. So their statistics differ from the government statistics, certainly when it comes to COVID-19. The government's data is not even based necessarily on a death being registered. And secondly, the government is counting deaths which have occurred outside of a hospital. Say somebody at home who may have had the symptoms of COVID-19 but has not been tested, which is alarming, absolutely. So the Office of National Statistics, their registered figure is based upon death certificates being issued and a coroner clearly stipulating coronavirus or COVID-19 as the cause of death. So the stats include daily deaths of COVID-19, going between 108 to let's have a look so it's not right at the beginning, because the first reported case in the UK was the 29th of January, so it's pretty much in the thick of things when the government was looking to shut down the economy, etc. So now let's have a look at the weekly death situation. Now, the number of registered deaths in England and Wales for the week ending 20 March 2020, so week 12, was 10,645. Now, as I mentioned, because of the 5-day difference, so they can actually take data into account up until the 25th of March to register if a death certificate was issued after that. So they'll give and take 5 days. So for week 12 of 10,645, now that represented a decrease of 374 deaths registered compared with the previous week 11. So 374 deaths down. Now, it's pretty contrasting to all of the news we've been hearing about exponential growth and catastrophic death rates, which are forcing the National Health Service to become overloaded, and the government subsequently converting the Excel Centre very near London Docklands, where incidentally I saw Vasily Lomachenko and Alexander Rusek both box in 2012. Now, that facility has obviously been converted into an emergency hospital now. So that's all occurring while the number of weekly deaths is actually coming down. Now let's compare this to previous years now. Now the average number of deaths for the corresponding week over the previous 5 years was 10,573. So that's the average for 2018, 17, 16, 15. So this means that the overall number of deaths in week 12 of 2020 was slightly higher than the previous 5 years. Slightly higher. Now, does slightly higher constitute a lockdown? The suspension of civil liberties? Individuals who have poured their heart and soul into opening their own businesses. Now they've been told that they cannot even trade. Their livelihood is all but in jeopardy now. Now they may have been employees for a certain number of years before that. Taxpayers paying whatever it is in the UK, minimum 20% income tax. If they're self-employed, then corporation tax, excise duties, VAT, value-added taxes, VAT on expenditure, pretty much everything you buy, excise duties. So, and many of them may have not even used the National Health Service in the past, fire, police, ambulance, etc. So they're not allowed to trade. Hence, either they have a mortgage or they're renting property. So clearly if they've got no income, there's no turnover, no revenue, no customers. So like a friend of mine now, she owns a small business. She is already £25,000 in debt. When we were previously working years ago in the city of London, she was on a very good salary. Um, her landlord is now threatening to evict her. The emergency funding that has been promised by the government has not been processed by the banks. The banks have admitted that they're very slow in processing applications, doing absolutely nothing. So do slight decreases warrant a complete shutdown and the potential of pushing this country into, an economic, not only a recession, which is free subsequent periods of falling output and GDP? We're talking about stagflation. We're talking about any public sector finances now firmly being in deficit, with 1 million registered applications for universal credit, etc., which could potentially rise to, they're saying, maybe 5 million. So people are losing pretty much everything. Not to mention the impact on the world economy when you're talking about an exogenous shock to the system in which the supply chains have been forcibly closed. So it's not a case that there was insufficient demand in the first place. There's no demand because supply has literally been terminated. And what I find shocking is that there's no scientific data on any of whatever the media has been scaremongering. Now, science is always used to disapprove a hypothesis, and my hypothesis is I have grave reservations about any disease being transmitted from wild animals to humans and then humans to humans. How does a test to differentiate between a common cold and the coronavirus? A coronavirus which has existed. Medical journals and encyclopedias have published it for over 2 decades, and is part of the family of diseases under the common cold. So how does a test differentiate between flu, influenza, the common cold, and the coronavirus? I'm very curious. The apparent AVR test, which determines if an individual has previously contracted coronavirus and has recovered from it. So therefore has developed the antibodies, so is now considered to be immune. That test has not even been legally approved, signed off. It's obviously got to be subject to clinical trials first of all. It's got to be tested on humans. That test has not been approved, that it's not been rolled out. I know Stanford University over there, they've been testing it for the last 5 days, which is staggering if the coronavirus has been known to governments, certainly in the United States and in the UK, for over 2 decades. They have not expedited, not even had the test in reserve, knowing that the SARS virus, we know, spread to 17 or 18 countries and killed, I think it was around 800. And the MERS virus, which where the epicenter was Saudi Arabia. So some of the newly emerging industrial countries, the Asian tigers, as they're known, South Korea, Taiwan in particular, their economies have not suffered. They've had no such lockdowns. Their testings per capita and their mortality per capita have been the highest and the lowest. Highest meaning the testing, and the mortality per capita has been the lowest in Israel as well, on the planet, simply because they had test kits available. They were able to administer them to patients who had some sort of symptoms. Their companies started developing excess test kits so that most of the population could be tested very quickly. And they were able to have a proper cohesive, sort of transparent system of identifying, of treating, not shutting down, not causing no panic. And well, I think the death rates are, are a reflection of how specific countries have handled, the treatment of the common cold. Now in the UK, you got to remember around 500,000 people on average die each year. So, an influenza stroke the flu normally kills around 2,500, between 2,000 and 3,000 a week. A week in the UK. So there's nothing startling about the statistics published by a department which has undertaken this task for decades. I'll try and come back with statistics for the end of March. So 20th to the 31st of March, or 21st to the 31st. And certainly April is going to be a key month as well, and try and do a comparison of that. So anyway, take it easy all.